Hey, what's going on? Dr. Taylor, Spark Chiropractic. Today I want to talk to you about one of the therapies we have in our office. It's called SoftWave. S-O-F-T, capital W-A-V-E. Why the capital W? I don't know, trademark or something like that. So, SoftWave, what is it? So, SoftWave, the way I explain it to patients, it's like ultrasound on steroids. It's what's called it's acoustic wave therapy. Okay. So, what do we got? We've got the machine itself. There's the little display thing right there. So this is where the energy comes from. And then it comes out, there's this hose here, and then we'll drop. And then there's what's called an applicator head. And it looks kind of like this, right? And then there's a big old bubble on the end. So this system here is filled with water. That's all it is. Just good old-fashioned, high-quality H2O, if you've ever seen Waterboy. And there's a reservoir in here. And deep in here, there's a spark plug, okay? And what happens is that spark plug creates a little shock, a little zap. Right there, right there. This is just straight up physics. Creates a little spark, pata, and it creates a pressure wave in this system. And what happens, now I say shock and I say spark, but it's not an electrical thing. This isn't stim. This isn't any sort of electrodes on the body. It just creates a pressure wave or an acoustic wave that comes out of this applicator head and then goes into the body, about 12 centimeters deep, right? Like that, okay? So now what does this do? Why do we have this? What's the point of this? So as a chiropractor, what do? I move bones. And as James Taylor, the chiropractor, I move them expertly well. I can't speak for other chiropractors. But there's also obviously a soft tissue component to a lot of the injuries that walk through these doors, especially when you see as many athletes as we do, whether it be our MMA fighters or our rugby players, baseball players, things like that. So they're going to come in, they're going to have soft tissue complaints. So if we've got, let's just say, a random joint. Here's a bone, they come together, there's your joint. There's going to be soft tissues around them and between them. There's going to be cartilage on the ends of these bones where they meet. And what they're going to do, they're going to help decrease the friction in the joint. There's going to be a capsule around it. This is called a synovial capsule or a synovial joint. So what this is, this capsule here holds its own fluid to help lubricate the joint so this thing stays smooth. Now, if we're working on like a sprain or a strain or a tear, we're going to have dislocations, subluxations in the joint. The joint physically isn't going to be properly lined up. But when that kind of stuff happens, we're also going to have insult and injury to the tissues around it. So from a chiropractic standpoint, what do I want to do? I want to make sure that joint is in proper alignment with the one above and below or the ones next to it, so that way it heals in the best position possible. But what else do I want to do? I want to make sure I address these soft tissue complaints we've got going on, because when we have an injury, there's going to be things that happen. We're going to have increase, if we get the caps off here, we're going to have an increase in inflammation, right? That's going to be the swelling and stuff that goes on. We're obviously going to have an increase in tissue damage. Right? All those things will be going on here. We're going to have an increase in tissue repair as the body starts to do that kind of stuff and fix the thing. So we have a lot going on at an injured joint. So this here, with this acoustic wave, helps all these things go in the right direction faster. Because what do we want to do? We want to decrease inflammation. We want to decrease tissue damage. We want to increase the repair process. So how does this all work? How does it all do those things? Number one, what SoftWave does, first and foremost, when you walk in here, is we're going to decrease the inflammatory process. Now, on an acute injury, that's a wonderful thing to get started. On a chronic injury, this is going to be a little more tricky. It's going to take more time, because what the body does is it follows the path of least resistance. And it gets really used to policies and procedures that it has to do over and over again. So if you've got a chronic injury, you've got chronic inflammation, that's the first thing that we need to get a hold of. That's the first thing we need to fix. But SoftWave will decrease the inflammatory process. Number two, it's going to increase the body's local stem cells in the area that we're using it. Now, what are stem cells? Stem cells are cells that can become any tissue. So if we've got damaged tissue, we need to repair it. We need cells that can become that tissue. The SoftWave machine, the acoustic wave, increases the body's production of local stem cells. There are more cells in the area which can now become the new tissue. Number 3, it increases blood vessel proliferation. What does that mean? It makes the body grow more blood vessels. So if we've got damaged tissue, if we've got inflammation, we've got swelling, we've got old damaged tissue that needs to be taken out, we've got new cells that need to get into the area. Basically, what do we need? We need more roads, right? We need more roads into the place. We need more roads out of the place. So with the acoustic waves and the specific frequencies we get the stuff set at, we get the body to reduce the inflammation process, decrease the inflammation cascade. We get the body to increase the amount of stem cells it produces to become the new tissue. And we lay down more roads to get more good stuff in and more bad stuff out. And you put all that stuff together, and what does it do? It means you heal faster. So this whole thing started, SoftWave in general, acoustic wave therapy, started with diabetic ulcers, specifically on the feet. And they found out when we apply this to the sores on the bottom of the feet of people with diabetic ulcers in nursing homes and long-term care facilities, these ulcers would go away. They would heal faster, and they would heal better than the surrounding tissue. And somebody went, hey, what if we apply this to another injury or another injury or another injury? So now we come in here and we've got someone with, if this is a knee, if this is an ankle, if this is a shoulder, man, if this is an old dad's knee, we're getting dad playing ball again. If this is plantar fasciitis, we're getting you to wear your high heels again. This could be the dad, could be the mom. No judgment here. But these soft tissue injuries are taken care of faster with SoftWave, because all it does, in the most general of sense, it increases the body's natural ability to do what it already does, just faster. So this is just one of the many therapies we have here at the office, and the reason being, it helps us help you better. So if this sounds like something that might benefit you, just give us a buzz or walk right through those doors. We're ready to help you when you're ready to be your best, naturally.